my name is Amy. I'm a nurse practitioner student. How are you doing today?
Good, how are you?
I'm good. So I hear you're going to be doing your physical exam today. Is that right? Okay, great. So let me get started here. So to begin, can you tell me your full name and date of birth?
Vanessa Della Torre, 4994.
Okay, and what's the date today?
March.
What
It's
day
Thursday.
of the week? Okay, great.
I don't know the day.
And where are you right now?
I'm in your house.
Okay, that's great. So the way that the exam will work, we'll go from the head to toe. And if anything feels uncomfortable, always let me know, and I'll just prepare you what I'm doing as we go along. Okay. So like I said, we'll start with the head. I'm going to feel for your skull. If any of this hurts, let me know. I don't notice any trauma or abnormal bumps of the skull. I'm going to look at the scalp, different places. Oh, your hair is so cute. Okay, good hair, volume and thickness, and spread throughout the skull, which is great. Next, I'm going to move on to your eyes. So go ahead and just look at me. I'm just going to look at your eyes. Sclera is white. Can you go and lower your lower lids? Great, kind of keep it nice and pink and moist looking. Okay, I'm going to take my pen light. I'm going to look for your pupillary constriction. So go ahead and just look at my nose. Great. Direct and consensual in the left eye. And direct and consensual pupillary constriction in the right eye. Wonderful. Oh, before I put that away, I'm just going to have you follow my pen. I'm just looking at the way that your eye movements are smooth. I don't notice any nystagmus, which is great. Thank you. I'm going to bring this close to your nose. I want you to just follow it as it gets closer. Great. Accommodation and convergence noted. And I'm going to test your visual fields. I'm going to stand behind you and I'm going to wiggle my fingers near your visual fields, and I want you to let me know when you see my wiggling fingers.
No. 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 No.
Okay. Wonderful. I'm going to move on to your nose. I'm going to look at your nose from the bottom up. Can you go ahead and lift your head there? Thank you. Looking at the mucosa, making sure the septum is midline. Everything looks good. I don't notice any trauma or erythema. Can you close one nostril and breathe in for me? Okay, and the other. Okay, I'm going to palpate some of your sinuses. Let me know if there's any pain.
Okay.
Frontal sinus. Any pain there? Okay. Maxillary sinus. Any pain there? Okay. And I'm going to look at your ear here. I'm going to look from the outside. Look at the tragus and the helix, the pinna, and look behind the ear as well. Great. Same with the other side. Okay. And if I had an otoscope, I would take my otoscope and I would insert it into the ear canal. Let me know if there's any pain with this procedure. And I would be looking at the ear canal for any cerumen. I would be looking at the hair distribution in the ear as well. Looking at the tympanic membrane for any bulging or fluid, for redness. And I'd look for the bony point of the malleus and the cone of light. In the left ear, it'll go towards the number 7 on the clock face, and on the right ear, it'll go towards the number 5. And with my wall of toys here, I'd also take my ophthalmoscope and go back to the eyes and come from an angle. I want you to look straight while I use my ophthalmoscope. I'm going to look at your retina. And while I go in, I'm going to look at the anterior structures of the eye. I don't notice any clouding of the lens. And at the retina, I would be looking for blood vessels in all 4 quadrants. I'd look for the optic disc and the macula, and I would do this to both eyes. So great, and I'm going to stand by you again, back to your ears. Sorry if we're back and forth here. I'm going to run my fingers together, and I want you to let me know when you can hear. Mm-hmm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 119, 120 let's move on to your mouth. So let me grab my light here. And go ahead and just show me your teeth for me. Okay, just looking at your gums. Nice and pink, you must floss. Can you lower your lip for me, please? Thank you. Yes, again, nice and pink, no lesions, crusting, white patches, and go ahead and open your mouth and say ah for me. You stick out your tongue and say ah. Good, okay, uvula moves up and midline and it's equal. And I'm looking at your cheeks and your gums and your teeth, your tongue as well. Again, no lesions, red spots, swelling, or white patches, which is great. Can you stick out your tongue for me? Like that. Good. Nice and midline, cranial nerve 12 intact. Oh, and we'll move on to the rest of the face, just as a whole here. So I'm going to ask you to do some silly faces. Can you raise your eyebrows for me? Great. And can you smile? Can you frown? And can you puff out your cheeks? Okay, great. And I'm going to place my hands right here, and I want you to bite down for me, okay? I'm going to feel your muscles move. Going to bite down? Okay, nice. And while I'm on your face here, going through your face stuff, I want you to close your eyes. I'm going to touch your face with this in different places, and I want you to let me know when you can feel it. Great. I'm going to move on to your neck region. And to start, I'm just going to look at your neck here. Everything looks symmetrical, inspection-wise. Okay, I'm going to feel for your carotid pulse. Great. Good. I'm going to ask you to, I'm going to put my hand on your cheek here, and I want you to try to move your hand against it. Good. Good. And I'm going to put your hands on my shoulders, and I want you to push up. Excellent. Okay, and I'm going to stand behind you, and I'm going to palpate your thyroid. Okay. Palpate for your cricoid process here. Good, and go ahead and swallow. Very nice. All right, I don't notice any masses here or nodules. Any pain with that? Okay, and swallowing was midline and equal. Okay. And let's move on to your heart. So my stethoscope doesn't have a bell. It has to do with different pressure that I apply on your skin. So let's go ahead and start that. You can breathe normally. I'm just going to take a listen. This is the aortic, pulmonic, Erb's point. Okay, you go ahead and lift up your brow there. Thank you. Tricus. And your PMI here. Excellent. Keep it lifted. I'm going to go ahead and palpate or feel your pulse here. Great. You can put that down. Okay. And I realized that I did not feel for your lymph nodes. I'm going to go back to that. Okay, so go ahead and let me know if you feel any pain. So preauricular here, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Any pain in any of that there? Okay, thank you. Sorry for that. Forward. And I'm going to palpate for your pulses. Good, brisk and equal on both sides there. And can I have your hands? I'm going to test for tap refill. Good. Less than 3 seconds on both sides. All right, and I'm going to listen to your lungs now, okay? Oh, sorry. Sorry about that. Yeah, when I place your stethoscope on your chest, you can take a deep breath in and out through your mouth.
Yeah.
If you get lightheaded, please let me know. Okay, I'm gonna listen to your right side here. I'm gonna lift your sports bra. Okay, and your left side. Good. No crackles, wheezes, or rails. I'm gonna listen from the back now as well. Deep breath. Good, and go ahead and take one more deep breath from me. I'm looking for, I'm just gonna watch you breathe from the back. Good, chest expansion looks symmetrical and equal. Your effort is pretty normal. You don't look like you're in any respiratory distress, which is great. I'm gonna go ahead and move on to your abdomen. Can you go ahead and lie down for me? Actually, I will need this. So I'm going to just inspect first for any lesions or masses, any hernias, which I don't see any abnormal movements of the stomach. I don't see any of that, so I'm going to go ahead and auscultate. I'm going to start in the epigastrium. Good. And I'm at the aorta now. Listening for any bruise, and the renal arteries as well. Okay, no bruise there. I'm going to listen to all 4 quadrants. Okay, and I heard bowel tones in all 4 quadrants. Okay, I'm going to go ahead and palpate. I'm going to start light first and go a little deeper after that. Please let me know if you have any discomfort, and I'll be watching your face as well to make sure that you're not in any pain. Okay, I'm going to start by palpating your aorta. Very nice. Okay. Light palpation first in all 4 quadrants. Any pain or discomfort there? Your face does not show it either. I'm going to go ahead and go a little bit deeper now. Okay, no masses there, no pain. Okay, I'm going to palpate for your liver now. Okay. So I'm going to take a deep breath in and then out. Okay, I don't feel the lower border of the liver, so that's also very normal. Sometimes you can, sometimes you don't. I'm going to have you lift your side there. I'm going to support your rib cage, and I'm going to feel for your spleen now. Go ahead and take a deep breath in and out. Okay, I don't feel the lower border of your spleen either, which is very normal. And I realized I forgot to percuss, so I'm going to do that now. I know it's a little out of order. But I'm going to go ahead and percuss. Okay. Great. You can go ahead and sit up. Okay. We're going to move on to your upper extremities. first I'm going to inspect your upper extremities. Any lesions, I'm looking at your skin. Excellent, nice and smooth skin. Looking for hair distribution. Okay, wonderful. And let's start with your strength. So I'm going to have you go like this. Okay, I'm going to place my hands here and I want you to push against my hands. Good. And this way. Nice. And then can you put your hands out like this? I want you to push against my hands with your wrists. Excellent. And go ahead and put your hands at your side. And then go ahead and push against my hands here with your arm. Good. 5 out of 5 strength with all your muscles there, which is great. We'll do some reflexes next. We'll do your brachial first. Oh, nice. Very easy reflexes for you. Very good. And your triceps reflex. Very nice. Very good. Okay, and we did your artery, your pulses, and your capillary fill. And let's move on to your lower extremities. I'm going to just inspect first, so look at your thighs here. It's nice and warm. Very good. I'm going to assess for edema in your lower extremities and your feet. I don't notice any pitting edema. I'm going to palpate your pulses on your feet, your posterior tibialis pulse, and your dorsalis pedis pulses. Very nice. 2+ on both of those. I'm going to get your capillary fill on your toes here. Less than 3 seconds. Very good. And I'm going to assess your strength in your lower extremities as well. Go ahead and push against my hand. Okay. Push against my hand. Okay, and I'm going to slip my hand under your thighs here. Go ahead and push against my hand. Good. And the other thigh. Very good. And push against my hands here. Very good. Very good. Yeah, your extension, your flexion, your abduction, and your adduction of your legs. 5+ strength. We'll do some reflexes in your knee and your Achilles. So go ahead and lean back in the chair and try and dangle your legs there. Oh, I'm so sorry. Hey, right, your patella right there. There we go. Very nice. And your Achilles reflex. Very good. Very good. All right, I'm going to have you stand up now. Okay, while we're here, let's have you close your eyes. I'm going to just test your balance here. Standing right here just in case you fall. Okay, go ahead and open your eyes. Negative Romberg test, which is wonderful. I'm going to have you walk. I want to assess your gait. Come on, come here. Come on. Thank you. Okay, go ahead and walk across the room, just normal. Thank you. And on your way back, can you go on your tippy toes? Okay, and then on your way back down, on your heels. Very good. Okay, you can come back normal. Just walk normal back. And I'm going to have you do what I do. So lift one leg, and I'm going to have you do a shallow knee bend here. Very good. And on the other leg as well. Okay, great. And have you copy what I do. I'm going to pat here and go as fast as you can. Good. You can go ahead and stop. And touch your nose with your finger, and then touch my finger, and then touch your nose, touch my finger, touch your nose, touch my finger. Great. Those are all cerebellar tests, and you passed with flying colors, which is great. What I'm going to have you do is test your spinal reflexes here. I'm looking at your posture. You have a great posture. Can you? Oh God! Can I have you touch your toes for me, please? Thank you. Okay, and go ahead and come back up. And can you arch your back? Very good. Wow, very good. Go to the side here and try to touch the side of your knee and on the other side as well. Awesome. And your chin to your chest and touch your neck movements here. Go ahead and go up and then back. And can you touch your ear to your shoulder? Your ear to your other shoulder. Very good. And then turn and look at that wall. And then turn and look at this wall. Very good. And I'm going to feel for your the spinal processes here. Let me know if you have any pain or tenderness at any point. Very good. Okay. And I'm going to do a shoulder test on you. Do you have any shoulder pain today?
Mm-hmm.
No? Okay, good. So we'll do some tests anyway. We'll start with the NEARS test. What I want you to do, I'm going to just stabilize your scapula here. I'm going to bring your arm up here. And I'm going to raise your arm up over your head. Let me know if there's any pain. Very good. Okay. Go ahead and make your arm like this. I'm going to lift up here. I'm going to stabilize this and lift your shoulder up, or your elbow, and let me know if there's any pain. No pain? Excellent. Next I'll have you put your hands out like this. And then I want you to take like a can like this and empty it. And I'm going to put some resistance here, and I want you to push against my arms. Any pain there?
Mm-hmm.
Very good. Next, I want you to, keep your hands like this. And I'm trying to resist, and I want you to try to turn your hands like this.
Okay.
But I'm going to try to resist it. Go ahead and do it. Okay, any pain with that?
Mm-hmm.
Very good. And one of the last things I'll do, I'm going to have you raise your arms up like this. I'm going to slowly bring them to your side. Excellent. Negative for the drop arm test. Let me think through anything else that I may have forgotten. Nothing is coming to mind. I think I did the head to toe here. Thank you for coming.
Thank you.